This video shows an alternative technique to revision patellar tendon reconstruction surgeries with allograft Achilles, the Codfish technique. It is noted that the authors have no conflict of interest to declare. The case is about a 42-year-old male patient who suffered a trauma and ruptured the patellar tendon. Reconstructive surgery was performed using anchors and homologous hamstring graft reinforcement as a primary repair. These are the post-operative radiographs from the initial surgery. 2 months after the initial surgery, the patient suffered a second trauma, causing a re-ruptured patellar tendon. This can be observed here with the presence of patella alta. After surgical prepping, the homologous Achilles graft is placed in a warm saline solution and laid out in a triangular shape, mimic the form of a dried codfish. The graft is then divided in 3 tendinous parts, each of them 200 millimeters long. A baseball-like suture is placed at each of the ends of the lateral stripes. The gap in the patellar tendon is identified. An anterior longitudinal incision is performed from the mid-third of the patella to the tibial tuberosity. Debridement of the edges of the lesion is required to properly identify the location of the re-ruptured tendon. Guide wire is used to identify the patellar and tibial tunnels from the initial surgery, and a 5 mm drill to remove the remnants of the tendons. Using intraoperative radiography, 2 5.5 mm metallic anchors are placed. The stability of the anchors is tested. 2 transport sutures are left behind, 1 in each tunnel. The placement of the non-absorbable sutures of the anchor are made in 2 stages. The first begins through the patellar tendon in a Krakow type, from proximal to distal and posterior to anterior. The wider end of the Codfish type homologous graft is placed over the tibial tuberosity and fixed with 2 braided sutures for correct positioning. After positioning the first sutures, the Codfish type homologous graft is then laid on the patellar tendon, and the second of the non-absorbable anchor sutures is performed through the patellar tendon and the graft Krakow type from distal to proximal. The gap is then minimized as the sutures are being pulled. Attention must be paid to the position of the knee at this stage, which must be in a full extension and neutral rotation. Each of the lateral stripes of the homologous tendinous graft are passed through the tibial tunnel with the aid of transport sutures, which will then pass through the patellar tunnel, assuming a zero-shape form. In the tibial tunnel, an absorbable 7 mm diameter screw is used to secure the graft. The conventional 1.8 mm methyl cerclage wire is passed through a lateral tibial cannulated screw in the proximal tibia and also under the quadriceps tendon. The sutures of the anchors are tied together. The gap is closed and then reinforced with several sutures. The 2 lateral stripes of the graft are pulled proximately through the patellar tunnel and sutured on the contralateral side with a non-absorbable suture. The knee must be positioned at 30 degrees flexion and neutral rotation. The Codfish graft is secured with a non-absorbable size 2 suture at the patella and quadriceps tendon. The remaining axis of the Codfish graft is cut. As shown in these images, the gap is closed. The cerclage wire is pulled and tensioned with the knee positioned at 90 degrees flexion and neutral rotation, serving as a form of protection for the previous performed reconstruction. The stability of the grafts is tested with a flexion-tension range of motion from 0 to 90 degrees. Immediate post-operative radiographs taken, and 2 months post-operative radiographs after the removal of the cerclage. At the 1-year follow-up, the patient presents complete range of motion with no complaints and has resumed his sporting activity to the same level as before the injury.